Hello, I'm Dr. Steve Kariya. Welcome to Housecall. Tonight we have a special guest, Dr. Famuyiwa, who's going to talk to us about your eggs. They're as healthy as your body. Welcome. I'm Dr. Steve Kariya. Welcome back to Housecall. We have a special guest, Dr. Yemi, who's going to talk to us about the egg. It's only as healthy as your body is. Tell me about yourself, how to pronounce your name, and your background, please.
Yes, my name is Dr. Oluyemisi Famuyiwa, and I am the medical director and founder of Montgomery Fertility Center. I also teach at George Washington University, and I'm a recent author of a book called The Quest for Fertility.
And where did you do your training?
Yes, so I'm originally from Nigeria, and I came here to go to undergrad at Kent State University and went to medical school at Emory University in Atlanta. So I did my residency in obstetrics and gynecology at Georgetown University Hospital in DC. And from there, I was interested in fertility and endocrinology, so I did a fellowship training in reproductive endocrinology and infertility at the National Institutes of Health.
Those are wonderful training and institutions.
Yes.
So let's get to the topic at hand. Eggs, they're as healthy as your body.
Absolutely.
What are the three most important things patients and physicians can do today to better protect fertility?
So the first thing you need to know is education. You need to know the biology of your eggs. And I will explain that a little better. Education. Educate yourself. The second thing is to know, especially for doctors who are out there, when do you refer patients to a specialist, right? You need to know the trigger points to help you set up. And the third thing is you need to be aware of your health, your metabolic health, your whole body health. If you know those three things, you are well on the way to protecting your fertility.
At what age does fertility begin to decline? And when does that decline become more significant?
So we see a precipitous decline around age 35. And to understand that, we need to go through the whole biology of how many eggs you have. You're born with all the eggs you will ever have. That's it. You don't get any more. And most of those eggs, the highest number is while you're still in your mommy's womb, around 5 months of pregnancy. You peak around 6 to 7 million. After that, there's something called programmed cell death, and you start to see the eggs die. By the time you're born, it's actually down to about a couple of million. And by the time you hit puberty, you're down to about 200,000, 300,000. And the programmed cell death continues. And you have a precipitous fall off around age 35, where it almost like falls off a cliff and then continues on downwards.
What's the difference between egg quality and egg quantity?
Quantity.
And why does that distinction matter clinically?
Correct. So I think you want to ask me what is the difference between the quantity and the quality.
Yes.
Huge difference, right? So let's use an analogy that most people will recognize. Let's say you go to a parking lot and you see 100 cars, right? So that's a lot of quantity. That's the amount of eggs still in your ovaries before they continue to die. That's the quantity. Quality is, out of that parking lot, how many have rusted engines, busted headlights, batteries not working, silencers gone. So you may have eggs, but how good are those eggs that you have? So we see a decline of quantity and also decline of quality. So as you leave those eggs parked off in the garage, they continue to rust as well as die.
Why does miscarriage risk increase with age, even in otherwise healthy women?
That's right. So you see women who are athletic, beautiful, healthy. What happens is when your eggs are, when you form your eggs at age, while you're in your mother's womb, it goes through what we call cell division, right? The eggs come out, the progenitor cells are made of 46 chromosomes. So in order to get the eggs ready to be fertilized, the chromosomes have to pull apart, right? So you get a reduction from 46 to 23. Those are pulled apart by spindles. But not only that, that pulling apart, it starts while you're in your mother's womb, and then it stops. It doesn't continue till you start ovulating those eggs. So those spindles are half pulling apart the chromosomes, and then they're frozen. So think about a rubber band that you stretch and you keep it in place for years. The bands start to snap. They start to be friable and break. So the DNAs don't pull apart very well, right? So now you may get errors in chromosome division. And when you fertilize an egg that has those errors, you will get embryos that have errors in them. Some of those errors can lead to miscarriages. Some of those errors may lead to embryos that have what we called a reduced reproductive potential. That's why, and if you imagine with age, you're frozen, the division's frozen in time for such a long time. So the older you are, the more this frozen is going on. And not only that, it's now exposed to anything in the environment is attacking this. And that just accumulates with age.
Why is the egg considered to be the most important cell in human reproduction?
Ah, yes. So think of your egg. The egg is going to be fertilized by the sperm. And then the embryo that results will start to divide into first 2 cells and 4 cells and 8 cells and so on and so forth. And the fertilization occurs in the fallopian tube. When the egg is fertilized, it starts to divide, and the tube moves the embryo towards the uterus cavity where it's going to be implanted. But the problem is, it's moving it. It's not really, there's no blood supply to that embryo. There's no stopover sign where we can get a rest stop and refill. So the egg is, if you will, your survival backpack. It has to pack all the nutrients that the embryo needs for this division before implantation. Not only that, it also has to power the division itself. It takes a lot of energy. So the egg has to have the battery backpack. Your backup battery, those are your mitochondria. So it has to take all these things along the journey for the tube. So you consume a lot of resources, you use a lot of energy, so the egg bundles that up. You know, like mommy knows best, so you're going on a long journey, she's got your water, she's got your sandwich, she's got your blanket. Dad shows up, hey, I'm ready, let's get in the car. The sperm just has to land on the egg, right? It doesn't care about, do we have enough water in there? Is there food in there? Do we have enough supplies? Anyone have the backup generator? The egg does all that. It's a lot of work for the egg.
I think you talked about this before, but
yes.
When does the woman's supply of egg begin, and how does it change over time?
So the change over time is, like I explained, you start out around 20 weeks of pregnancy. The eggs start from what we call progenitor cells, right?
Okay.
Somewhere in the yolk sac, when the embryo is still being formed, really. And then those cells divide so rapidly through mitotic division, right? And they peak somewhere around 20 weeks of pregnancy. But what happens is, because you have such rapid division, there could be errors in that division. So then the body recognizes it, and you have some, what we call apoptosis, is programmed cell death, to try to clean up all those errors. So you start to mop it up, kill it, just soak it up, get rid of it. So by the time you're born, that 6 million is cleaned up, if you will. down to 2 million. Then you have continued apoptosis that goes on. Programmed cell death does not stop. And it continues till after the baby is born, till when menstrual cycle starts at menarche, whatever that age is. Now, when you start your menarche and you start ovulating, you'll only ever ovulate 400 to 500 eggs in your entire life, right? So you have a lot of eggs that are not necessarily ovulated. And these eggs, they are kept in the ovary in a suspended, frozen state, okay? They are woken up by the brain, but the brain wakes them up in waves. It doesn't just wake up one at a time. And this gradual waking up can take up to a year. It is towards the end of that waking up phase that we can now start recognizing follicles that may be getting close to ovulation. So the eggs are dying naturally, apoptosis. The brain wakes up a basket of eggs in waves. Now, the funny thing is the brain can select one egg out of that basket that it's woken up, and it's going to toss that basket away after it's selected the dominant egg. Then there's an acceleration of the apoptosis. So by the time you get to menopause, you're not really down to 0. You're down to about 1,000. But most of those eggs, the quality is not as sustainable anymore. And one of the things I like to tell my patients is, if you want to think about quality of eggs, did you ever play musical chairs as a child? You remember that?
Yes.
And you remember the music stops and you have to sit? Now, imagine if I told you, Dr. Kariya, you're about to sit, stop. Halfway through the sitting, you can't sit up, you can't stand up. So you're frozen like that. And I'm going to keep you frozen for years. Something's going to start happening to your muscles and your bone, right? They're going to start to snap and crackle. That's the job. The egg has a lot of work to do. And it's frozen in this time. And it's under stress and environmental factors.
We have about a minute before we have to take our break, but can you tell me a little bit about what ovarian reserve is? And
yes.
How is it different from the woman's ability to get pregnant?
Yes. So the reserve is what I was talking about, is how many eggs do you still have left?
Okay.
Let's do another analogy real quick. Look at your reserve as a trust fund that your grandmother gave you, except the bank can play with your trust fund. You can add to the trust fund. It can withdraw money from it, take it out. It can move money out when you want. How much is left in that trust fund? That's your reserve.
Well, that sounds great. Now, I think we have even more material, although we've covered a lot of ground.
Yes.
So we need to take a brief break for our public health announcements. Again, this is Housecall. I'm Dr. Steve Kariya, and we are talking about eggs, fertility, and your eggs are as healthy as your body.
Do you remember our first group photo? This is it. Smiles all around, even though we were all nervous.
Who could have imagined that our first weekend together would soon turn into a lifetime of memories?
You're an amazing young man. Your brothers and sisters really look up to you. They're a big brother.
It's so cool to watch the adult that you've become, and you really have done as much for us as you think we've done for you.
You know, it took 20 years, and I got my third child, who was 17 at the time.
There's so many rewards in life. You coming into our home was one of the greatest rewards we could have ever had.
I ain't never felt so much love before in my life.
Welcome. I'm Dr. Steve Kariya. Welcome back to Housecall. We have a special guest, Dr. Yemi, who's going to talk to us about the egg. It's only as healthy as your body is. So I'd like to know a little bit about the term AMH. How does it apply to egg fertility, and how should it be interpreted in clinical practice?
So the AMH is a hormone that's produced by the small eggs that are still in the ovaries.
Okay.
So because those small follicles secrete this hormone, the level of the AMH depends on the quantity of the small eggs still.
The quantity.
The quantity. So we use the AMH as a biomarker for how many eggs do you still have left.
Okay.
Right. So it tells us more about the quantity, not the quality.
And is this sampled in the serum, in the follicles? Okay.
Yes, it's a blood sample. It's a AMH level. It's a blood work.
What are the limitations of this AMH testing?
So the AMH tells us how many eggs are there. What it doesn't tell us is how many of those eggs are good. What is the quality of those eggs, right? So it's like you go to a grocery store and you have white eggs and brown eggs and maybe some, eggs that may be dead on the inside. You can only count those eggs. You can't tell how many are good.
When should a primary care physician refer a patient for fertility evaluation?
So fertility evaluation is really key. That has to be done timely. If someone is less than 35, if they've been trying for over a year, send them on. If they are over the age of 35, then only 6 months, okay? Or if they have certain disease conditions such as polycystic ovary syndrome, diabetes, if they have endometriosis, then those patients, you don't want to wait. You want to send them over as soon as possible.
How early is that? That's not just waiting until 35, it's earlier than that.
It's earlier than that if the patient has endometriosis, if they have any metabolic problem, then you want to send them to a specialist sooner rather than later.
At what point should women begin to think about freezing as part of the reproductive planning?
Yes. So we now know that somewhere around the age of, I would say between 28 and 32, when you have good quality eggs, you should think about freezing those good eggs.
Okay.
Yes, so that would be around the best time to freeze, because we know by the time they get to 35, 38, the quality starts to go down. So a good time to think about it is late 20s, early 30s.
Now, how do lifestyle factors such as weight, sleep, metabolic health affect or influence fertility?
So when we talk about that, we're talking about the effect on the eggs. Now, someone who's diabetic, who's uncontrolled, right, or someone who has endometriosis, you have an inflammatory condition going on in the body. I think a lot of doctors have talked about that in different parts of the body. For instance, the neurologist or the heart doctor talks about it. Well, those things also affect your eggs and your sperm. So there are things you can do to limit exposure to certain environmental toxins. If you are diabetic, make sure your diabetes is well controlled. We do know that if you have a higher BMI, you have insulin resistance, for instance. That can have an impact on your eggs. So you want to make sure you're evaluated, make sure you don't have insulin resistance. If you can lose weight, I know it's hard for some people, and those we would tell my colleagues, for instance, maybe consider using some of the GLP-1s to help them lose that weight before they conceive.
Does GLP-1 use affect fertility?
It is advised to stop it before 2 months of pregnancy. Now, there have been studies coming out saying that some people have gotten pregnant while they were on it, and they didn't necessarily see any adverse effect per se. But if you look at the manufacturer's recommendations, which we try to follow, they recommend that you stop it 2 months before you get pregnant.
So I know that we're talking about some very expensive ventures. Could you educate me a little bit on some of the financial considerations that I
Yes.
guess mostly women
Right.
have to think about
Yes.
when they're planning this.
Yes, fertility does present a certain special burden that it can be very expensive. Now, one of the things that we are blessed, we live in Maryland. Maryland has a state mandate for fertility coverage if the plan originates in Maryland. And that mandate came about even before the Affordable Care Act. So if people want to look into buying insurance on their own, they could go into the exchange. Make sure you select a plan that does cover. Some plans do not. Some plans will only cover the diagnosis, but not the treatment. So people are shocked when I tell them, yeah, it will cover that. So going through the exchange in the state of Maryland, we are very fortunate because we have a mandate. The other part is some people look at their employers. Employers are providing coverage. Different employers provide different coverages. So you can also start with your employer and ask them what the benefits are. Talk to your HR person, see what is covered. Be careful. Sometimes they only cover diagnosis, just a workup, not the treatment. Some covers treatment, but not the medication. And then for my self-pay patients, there are several financing plans that they can evaluate. We partner with some financing. We don't really partner, they're independent, but we refer patients to them who can help them to finance it. I ask patients also, talk to your own bank. You might be surprised you can get a medical loan from your bank. And there are certain websites where you can get discounted medication. I know Serono has a program that they call Affordable Care Act. And if you apply, you get a deep discount. So I do help my patients kind of look for all these avenues. And lastly, a company like Kaiser, if you're a patient of Kaiser, they provide excellent coverage as well.
Now, this is all with regard to the infertility
Yes.
medications, but that doesn't cover the egg storage if people feel like they have to
Correct.
delay things. Is that
Yes.
correct?
Actually, well, a lot of the plans that offer treatment coverage, I'm now noticing, at least with my patients, also cover storage fees.
Oh,
Yes.
wonderful.
Yes.
Because those can be quite costly, isn't
Yes.
that right?
Yes.
Now, this is an increasing problem for
Yes.
many women are delaying fertility, aren't they? I mean, what's the average age of mothers and how has that changed over time?
Well, we do know that the demographic of the patients who are delivering has increased with time. And that could be for several reasons. Some people are delaying because they're pursuing a career. Some people are delaying because the right person simply hasn't shown up. So there's a number of reasons. And then other people's may be delayed because they're trying to get their finances together. So, or access to care, they simply don't know where to turn to. And I tell a lot of patients, you might want to start with your primary care doctor. Just say, is there ways you can point me out in the right direction? So I spend half my time educating people about resources that they had no clue they could have available to them.
One of the things that you talked a little bit about is, we've talked about weight, we've talked
Yes.
about metabolic health.
Yes.
How is sleep influencing fertility?
Isn't that something else? When you deprive yourself of sleep, we now know that there's evidence that it could dysregulate your hypothalamus. So we have what is called an axis in the body, called the hypothalamus,
Yes.
pituitary, gonadal axis, or HPO when it comes to women, HPT when it comes to men. So it's a cycle, it's an orchestra, and the brain conducts this orchestra, based on how much rest you have, how much melatonin, how much stress, how much inflammation is in your hypothalamic area. When you deprive yourself of sleep, you dysregulate this axis, and you may start having problems with ovulation, right? There were studies where they showed that women who were sleep deprived or worked night shift had evidence of lower success with even fertility treatment.
Isn't that interesting? So night shift is not necessarily a good thing for women trying to get pregnant.
Yes, or make sure you get adequate recuperation after your night shift. Make sure you have, light blocking windows. You flip your days and make sure you get your good sleep in. And if you're not sleeping well, you can go and get all these ring monitoring apps nowadays where you can wear a wearable that tells you how much sleep you're sleeping and how much deep sleep, light sleep, REM sleep. So you can try and regulate and get that. When you're going to bed, turn down noise. And if bedtime is daytime for you, make sure you're darkened, make sure you turn out noise, have a rhythm so your body knows, oh, okay, this is the ritual we do before we go to sleep. So you have a routine, and then your body learns that routine and try to keep the same time frame.
Conversely to sleep,
Yes.
how does exercise affect fertility?
Exercise is fantastic. You're moving your body. It helps you decrease insulin resistance. The key thing with exercise is too much of it can be a bad thing. Just the right amount, go for a walk, help you digest, make your body flow. But if you overdo it, like for instance, some marathon runners, Olympic gymnasts, then you flip the switch to the other side, where you now dysregulate uncoupled ovulation signals. And so a lot of times people who are chronic marathon runners or, addicted to exercise, if you will, they stop having their menstrual cycles.
Yes.
They stop ovulating. So in the right amount, yes. Overdo it, not good. Underdo it, it's not healthy for you anyway. And that goes to your metabolic health.
So moderation is good.
Yes.
So I think we've had a great education on eggs, fertility, and the influence that body health has
Yes.
in all of this. So I want to thank you so much, Dr. Yemi, for educating me, and I know our viewers, in terms of the relationship between eggs, how this is a timeline that few of us,
Yes.
I think, have control over, the factors that viewers will have to think about in asking for help
Yes.
and in modifying their own important lifestyles
Yes.
to maximize their fertility when they are ready.
Absolutely.
Thank you to my guest, Dr. Famuyiwa, for joining us today, and to our viewers for watching Housecall. I'm Dr. Steve Kariya. See you next time.